One of the things that we've observed in this pandemic is what I call real-time corrective science. As more data comes in and there's new variants, you change recommendations. So I think the main reason for shortening the interval from the original series to the booster is Omicron. Omicron requires higher antibody levels. In an ideal world, vaccination would prevent infection, which would keep the virus from propagating in the community if enough people were vaccinated. What we're seeing with Omicron is that the vaccines are not highly effective in preventing infection, although they are very effective in preventing serious illness. So if the goal of the vaccine is to keep people out of the hospital, the vaccines seem to be very effective in keeping people out of the hospital with Omicron. If the goal of the vaccines is to simply prevent all infections, the vaccines are not as effective with Omicron. So the immune system is complex. The easiest thing to measure is antibody levels. There's much more to the immune system than that. There's T cells and B cells, and they're really hard to measure except in a research setting. So antibody levels are the thing we can measure, and we know that antibody levels tend to fall over time. Omicron requires higher antibody levels. So if you got a primary series of Pfizer, Moderna, or whatever, you have a good T cell immunity, B cell immunity. But we're seeing with Omicron that with antibody levels falling, it may not be as protective against infection. The T cells and B cells still probably protect against severe illness, but the highest level of protection comes when, in addition to the cellular immunity, T cells, et cetera, you have robust antibody levels. And there's abundant data now with Omicron that as antibody levels fall, you're less protected against Omicron.